Hello, Assalamu alaikum. Good evening, everyone. This is Dr. Zaib Qureshi. I hope you guys are listening to me and I'm audible. So before we start, I would suggest and advise everyone to change your name from iPhone, from Samsung to from your original name, because that is going to be easy for me to recognize and that is going to be easy for me to call your names as well. Okay, so please. Okay, Gul, thank you so much. So please forgive my this voice because I am under weather, and this is very bad. I'm sure you guys know that, and it is taking a lot of time, and it's been like 5 days I'm under this bad weather, and it is so bad. I hope you guys are taking care of yourself. Okay, so hi May, how are you? So we are going to be talking about MRCPI exam and its, the strategy, its tips and tricks, and it's like, kind of how we are going to ace this exam. Of course, I'll be talking about in depth about how we are going to, crack this exam in one go. But of course, you have to do, the proper hard work for every exam. Always remember, none of the exam is going to be a piece of cake. Okay. And since the world is evolving and world has, they moved towards more competitive exams now. So this is not going to be an easy exam. All you need to give is you have to give your 100%. Okay, and of course extra effort and dedicated effort, I must say. Walaikum assalam, Asya. I am okay. You can see that from my voice. I am suffering from this bad weather. Okay, viral fever, cough, flu, chest pain, body ache. I don't know what, and it's been like 5 to 6 days, and it's not over yet. But somehow I did not want to postpone this session because I know your time is equally important than the everything. So we have to start. We have to kickstart our the course, and if the beginning is lousy, things are going to be lousy as well. Okay, and being a the very the dedicated and dynamic mentor, I really want you guys to be on track as early as possible because we have to start our session. And before starting the formal online sessions, it's a very good idea that you guys have a good insight about exam, good insight about what this exam is going to bring in your lives and how this is going to change your career paths and how this is going to be helpful in your career as well. So before we start, can I ask one question, please? And without any hesitation, I would like to, ask all of you to give me the honest answer. How many of you know about this MRCPI, Royal College of Physicians of Ireland exam, obstetrics and gynecology? What exactly do you know about this exam? Anyone? Please open your mic and please do talk to me. It is going to be easy rather than the so monotonous. Then one person is speaking and the all of the rest of the people are just listening. So what do you exactly know? What exactly do you want to achieve out of this exam, and what are your perspective towards this exam? So I would like to hear from the all of you, in fact, and anybody can tell me. Yes, please. Yes. Yes, Farah, do you want to say something?
Yes, ma'am. I just want to say that do we need any books or these guidelines are enough?
Okay, so we are going to be talking about syllabus as well in a while. Okay, my question was, what do you expect out of this exam, and what do you exactly know about this exam? What do you expect? Why are you going for this exam? What's your aim?
Well, basically, of course, we want
Mhm.
to excel in our career
That's
and to
what I
get
really want to
this.
hear. Brilliant, bravo. Because excellence should be our, the aim all the time. Okay, because
Yes, definitely.
every exam gives us, the opportunity to excel in our career, to excel. What do you want to become in the end? You, me, or whoever is in this MRCOG business, or this MRCPI or MRCOG business. We really want to serve our community, isn't it? So if we are, the good for internationally recognized exam, it is going to, they give us complete insight towards international protocols, international guidelines. And by the end, if we utilize all those protocols and guidelines towards our patient, we can become, the very helpful doctors to our community as well, isn't it?
Yes,
So very good,
yes,
very good. Very brilliant answer. I'm so happy. Thank you. That's exactly what I thought when I was, DMing for all these exams. People used to call me crazy. People used to call me names or something, but I never looked back. I knew that what exactly my aim is. And today, Alhamdulillah, I feel myself towards that track where I can, benefit my patients, my own students as well, because I'm a teacher as well. So yeah, altogether, it's going to give you, I must say, a very new idea how to see patients and how to treat patients. Very good, very good, very good, Farah. Looking
Thank
forward,
you,
looking
ma'am.
forward to see you again in rest of the online session. Hi, Aisha, Arjuman. How are you? Asma, JM, and Hanan, Gada, Geeta, and Noor, Faiza, if I'm not wrong, right? The name is Faiz. Okay. So, Abida and Zainab, how are you guys? It's a postgraduate degree, of course. Beside this, want to be more. Yeah, of course. Precise in a way that, of course, we want to benefit our patients, okay? From our knowledge, from our, the techniques, from our, the better idea how we can be a beneficial, the doctor to our community, isn't it? Apart from that, of course, before that, you have to pass this exam. And today in our session, we are going to be talking about how we are going to crack this exam in one go. All right. So this is going to be a very comprehensive session. So please forgive me if I, the cough, sneeze, or, the do anything, because that is very natural and this is going to be very normal as well. So, but still I will try. I will try my level best. Okay. So, this is the Royal College of Physicians of Ireland building. And in fact, in this, the computer, I didn't have my own picture. Otherwise, I have my own picture just right in front of this, the door. And it really feels like a dream come true when you go to, the Ireland, Dublin, when you stand in front of this college. Okay. The feeling is like, I mean, you can't even describe in words. Okay. So, this is going to be on the graduation day, graduation ceremony. This is, the Calgary Street, number 6 building, the Royal College of Physicians of Ireland. Very beautiful building, very, the kind of antique, you can say. Okay. Traditional, because it's a very old, the college. Even this college is older than MRCOG, right? The Irish one. So this is going to be our graduation day once you finish your MRCPI in Ops and Gynae. So this is how you are going to be in your gowns, and the feeling is very, the out of the world. Trust me. So, the before starting this journey, you all need to aim yourself to be sitting or standing like this, wearing gowns, okay? With this, the president, and again, in front of this college. Because, this is a dream of every student, be it MRCOG, MRCPI, or any postgrad exam. We really want to feel, that, the college, even being an overseas, we are here, okay? But still, we really want to visit that place which is giving us this much, the kind of worth, this much kind of hope, and this much kind of knowledge as well. So, yeah, so from here, from tomorrow, today onwards, almost roughly, we do have 90 plus days till our, the 7th March 2024 exam, right? So this is going to be your timeline. So of course, this is not going to be something which you have to take easy, which you just need to take for granted. No, you have to study hard for this exam as well. Okay. So before we go on and discuss how we are going to utilize these 90 days, so let me tell you that, the success, ladder to the success is not easy, right? First, you have to think about it. Then you have to put up your ideas. Then you have to plan wisely. Then you have to try harder and harder, and again, try again to become a successful person. Okay. None of the student like me, okay, let me give you my example. If I have done 4 the exams after my bachelor's, so it wasn't an easy journey. Okay, it was full of, the kind of hurdles, and it was a kind of, the roller coaster. Okay, not even MRCPI, MRCOG. Okay, but yes, FCPS was in first go, but MRCOG I flunked, the theory ones. Then I flunked, the OSCE. Then, the MRCPI, I flunked theory. Can you imagine? Because I was so overconfident at that time. Okay. So, when you are trying to go for any exam, you just need to think that you are a starter. You are not a consultant anymore. You are just a student, and you have to put yourself in the shoes of a student, newly grad. Okay. So make sure that you are thinking in this way. Otherwise, the results are not that, the promising. Because I'm giving you my example. When I entered into this MRCPI, I was already MRCOG. Okay. So I was kind of, so overwhelmed. I was so kind of, let me put up it a very straight, the fact I was kind of overconfident. So you need not to be overconfident. You need not to be underconfident. You just need to feel yourself as a starter, okay, as a student, as a very newbie in this, the MRCPI business, okay. But again, don't take this exam as a very easy exam, because this is equally competitive. Because this exam is going to give you a worth worldwide. This is going to be a very, the good exam worldwide as well, okay. So make sure that you are planning from today onwards, and planning has to be very wise. And of course, once you are going to give your 100%, once you are going to be 100% prepared for this exam, then only you can go for this exam, and then only you can try for success. Because being a student, whatever aim is, of course, we really want to pass our exam. But before that, what exactly do we need? We need to give our 100%. If you are not going to give 100%, so you cannot be, the sure of your success. Because at least, the result is not in our hand, but yes, hard work is in our hand, isn't it? So work hard, work smart, stay focused, and with the very the kind of enthusiasm, start your journey. Okay. And don't be upset. Don't just look at the the failure stories. Do try to look at some success stories as well. To the stories where the people have failed and then people have passed, and to just the gather the idea about how you are going to use those stories for yourself. Okay. So first of all, we are going to look at what exactly is MRCPI exam. So it is basically accredited by the Medical Council of Ireland as foremost knowledge-based assessment for obstetrics and gynecology in Ireland. The qualification shows potential employers that you have advanced knowledge of this specialty. You can take history of patients, you can perform clinical examination and formulate investigations and management plans. Just focus here and just listen to me very carefully. This exam is not all about theory all the time. Okay. This exam is more towards clinical, the scenarios. The clinical scenarios which you see in your day-to-day life. Okay. The exam is going to be more patient-centered rather than, the bookish one, rather than the theory one. Okay. So what you need to put up? You need to put up your own knowledge, but of course, in the lines of guidelines. That's why guidelines are mandatory and necessary to go through. And once you are not going to be familiar with these, the system, how you are going to treat, then of course, it's not going to be easy for you. So studying guideline is equally important to treat the patients, but otherwise this exam is more clinical rather than theoretical. So in Ireland, being an MRCPI means you are ready for higher specialist training, the final training before individual practice. Individual practice means private practice. Okay, so this is going to be a membership exam. This is not a degree again. Okay, by this membership exam, you are going to get entry ticket into the RCPI, which is Royal College of Physicians of Ireland. So once you are going to get enter into this college, then you are going to go for higher specialty, higher specialist training. Be it, the anything. You can become, the senior registrar or registrar, being an overseas, the candidate. Then only you can enter into your specialty training. And then you can choose your respective field as well. It all depends on what exactly are you aiming for, what exactly are you looking for out of this exam or no. But it is very much mandatory that you know the structure of college and this degree first, and then you go about how you are going to utilize this, the membership exam. All right. Then question arises, why to take MRCPI? What are its benefits? So it's an additional prestige in your achievement list, like for me, right? Recognition from Royal College of Ireland. Plus, it's being recognized by UK as well. From MRCOG Part 1, you can directly apply for MRCPI 2 exam. More job opportunities, more doors to learning in competitive environment. It's going to be an addition to knowledge base and enhancement clinical practices. A new feather in your medical achievement cap, isn't it? Why not being an MRCPI? Its booking has a long time and less difficult booking procedure comparatively. Since 2021, you can get registered with GMC as well in UK and work in UK as well. So it's a win-win altogether, isn't it? So it's not going to go in vain if you just go for this exam, or even if you are a fresher, the after MBBS or, the MBCCH, from graduation, let me tell you. So if you are attempting for this exam right after your graduation, or if you haven't done anything right after your graduation, this is going to be a very good membership exam. Okay. And let me tell you, it has got a very much worth all around the globe. So it's not going to be a kind of, the useless membership even if you go for this exam. But of course, yet again, many things are involved, right? Many things are involved when being an overseas, we are going for any, the membership, international membership exam. So of course, you need time, you need energies, you need resources, right? Of course, apart from social support, apart from, the psychological, financial aspect is also there. So if you can go for this exam as well, along with your, the rest of the membership exam. So yes, this is not going to be a kind of useless, the membership. Okay. Yes, it has got scope in Middle East as well. But yet again, you have to look for your opportunities. So it is going to be recognized. Okay. Like MRCOG and MRCPI both. So it all depends on which hospital you are applying at. So it's not going to be again, like what we think. If we do any membership exam or fellowship exam, we are just going to enter into, the a royal kind of, the life. So it's not going to be like this. We have to work hard. We have to look for opportunities. We have to look for a hospital which can accommodate. Okay. But as a whole, this membership exam, this is fairly recognized, the all around the globe. Okay. So this is going to be, the very good idea that if you want to move to UK with this MRCPI, you can. Okay. But yet again, the level which you are going to go at, this is yet to be determined. But yes, you can enter into UK, you can enter into Ireland as well. Then exam pattern, very much important to understand. Okay. We know that there are two parts in MRCPI, the obstetrics. Okay. Two written exam, one paper, 100 single best answer questions, 3 hours. It is being held twice a year, no negative marking. Since COVID pandemic, it is online with remote invigilation. Okay. But from home or from wherever are you, the attempting at. But still, we need to see the final decision by college about, the venue. So make sure that you are looking at your emails all the time. Make sure that you are scanning your, the website, the all the time. So it's a good idea that you are well versed with the new changes as well. Okay. Part 2 is going to be, the clinical. It is going to be exactly clinical, with real patients in the sense that you are going to get, the role player, which is going to act as a patient. So, I'm sure all of us are well versed of all these exams, right? Because in Pakistan, in India, in Egypt, in Middle East, in almost Malaysia, Singapore, almost all countries have adopted the same system, OSCE, right? So we do have OSCE as well in MRCPI too. So we will have 7 active stations in OSCE, 10 minutes each. Unlike, the MRCOG, which has got 2 minutes reading time and 10 minutes, the performance time. But in MRCPI, you will get only 10 minutes to perform, to read the station, and that's it. Out of that, 2 cases are going to be of gynae, 2 cases solely are going to be on ops, 1 case is going to be labor, the board, and 1 can be, the any other, 2 can be any other clinical, the aspects. So make sure that, of course, this is part of, the theory, but after that, we are going to have a comprehensive session about OSCE as well. Then there is going to be a long case as well, 25 minutes complete, in which you have to take history first, then you have to present that history, and then you will have a clinical discussion, like almost all long cases all around the globe. So OSCE is available in Ireland, UAE, Oman, and KSA. And the venue is being decided by the college. And, the years, most of the time it is twice a year, but sometimes they give extra diet as well, depending upon the load, depending upon the demand. Okay. So first thing first we will learn about the theory, written part. So written part, one must have one of the following qualification. documentary evidence. So exemptions are there. Okay. So I will advise all of you that who guys, they have exemptions. So go for it. Okay. This is a golden opportunity. We don't know what will happen after 6 months or after a year or so. Okay. From India, from Pakistan, from Malaysia, New Zealand, Australia, and, the MRCOG Part 1. Okay. But exemption from MRCOG Part 1 is not accepted. But, the active MRCOG Part 1 is accepted. Okay. So MRCPI Part 1 in General Medicine Pediatrics in the last 6 years, and Australia, MRACOG, MRNZCOG, FCOG, FCPS from Pakistan, and medicine, in obstetrics and gynecology, Malaysia from 2008 onwards. So we have got a couple of exemptions. Okay. So I think being a, the student in this MRCOG, the obstetrics and gynecology business. So I would suggest all of you that whoever has any exemption, okay, can go for this if circumstances allow. So this is not a hard and fast rule again that everybody has to go, everybody has to follow the herd. And the thing is, you need to look at yourself. What exactly do you want to achieve out of your, the career? Okay. So eligibility criteria from January 2019, it has, the limited to 6 attempts. It means that you have 6 attempts of each component of the MRCPI exam, means total 12 attempts for the 2 parts, 6 each, theory and OSCE. You must pass the Part 2 examination within 6 years of your first attempt. So rule of 6. Again, 6 chances, 6 attempts, and you have to pass within 6 years of first attempt. So entry criteria is again, the very easy. Okay. Earlier, they used to say that 2 years, the training or 2 years clinical experience is sufficient. But now they say the total 18 months of post-registration training is recognized. Okay. 9 months in OBS, 9 months in gynae, or in combined post, we do PG training, isn't it? So if any country has PG training of 4 years, which I believe there is, almost all countries have postgraduate training for about 4 years. Okay. 2 or 4. So I think you guys are fairly eligible to go for this exam. What you need to do is that you have to have your, the valid documents with you. Okay. You have your, the documents scanned with you. A tested copy of your primary medical degree. Okay. It means MBBS or whatever from your respective countries. A recent color, the passport style photo. A copy of your Part 1 or exemption. A testimonial of 2 referees. Referral forms are available on website. Okay, you can download it, you can get it printed, you can sign it from your 2 referees. And then again, 2 referees doesn't mean that, they has to be, the MRCPI as well. Anybody from your hospital who know you, but has a stamp, okay, has a name, designation, and a stamp. Okay, anybody can, they refer you that, yes, I know this doctor personally. So these documents should be attested. Okay. From, the multiple, the sources. Okay. So it can be for us, for us like overseas candidate, I think we can go to the solicitor, notary public, or a lawyer. Okay. So we can go easily. All right. Or if any person who has done MRCPI, can attest your documents as well. Then, translation is mandatory for, our respective, the Arab candidates, because they do have, their certificates in Arabic. Okay. So it's a good idea that you get your, the official translation. All right. Before, they go into this, because Ireland comes in Europe, right? So usually, they speak in terms of, the documents, they speak a very, the kind of a different language. Okay. You will learn about that once you will go for your OSCE. So translated, the letter should be there. Okay. Is it clear till now, everyone, that, what exactly is needed for this exam? Any questions so far?
No, ma'am.
Okay, very good.
I have one question. This regarding the attestation, like our FCPS degree. We have to test it by the FCPS our college. That is okay.
FCPS degree. You can upload it because you have to upload all these documents.
Yes,
Okay.
because that is already attested by this college
Yes,
of
yes. It
Aspirants.
is
It
already
is okay?
attested. So yeah, it is
Yes.
okay. Hi Mona, how are you? So good to see you. How are you, sweetheart? Okay, okay. Scope in Middle East, okay. I have answered it, and rest of the questions also I have
Hi,
answered.
Mom.
I'm good, alhamdulillah. Thank you. How are you doing?
Alhamdulillah, Alhamdulillah. I'm so
Alhamdulillah.
happy that I met you.
Same.
Yani, honest, appreciating your effort. Thank you so much. But I hope this time, inshallah, I change my career for MRCPI. So I hope,
I'm
I
here.
hope.
I'm here to help you. You know that my doors are always open for you. Okay.
Thank you
So
so
I'm here
much.
to
Thank you.
support. I'm here to help and guide. Okay, Mona. So anytime,
You know,
anytime.
more than that, in MRCPI part 2, more than that, it will be a disaster for me.
I'm here. I'm here. I'm here for you.
Thank
Okay.
you so much. Thank you so
Anytime.
much.
Anytime.
Thank you.
Okay.
Alhamdulillah. Okay. Thank you so much. Thank you.
Alhamdulillah. If you have submitted your documents before and you didn't get your seat, so that is well and well good. Okay. Once the seats are going to be announced, you will get an email and you will be directed to your website. Okay, May? This is what I know. So it doesn't matter. You just have to upload your documents once and then you have to patiently wait for your, the seat. Okay. So don't worry about it. This college is very easy in this term, that you don't have to, do a lot of hassle and you don't have to run after so many things. But yes, because of the, the kind of load you can say, because of the demand you can say, things are a little bit, the tricky in the recent 2 years. Okay. But overall, it's not going to be like, you are not going to get the seat, but it's a good idea that at least you apply. Okay. Apply for the first time even. Okay. Because you don't know what will happen, because this college announces seat even 1 month before exam as well. Okay. No, sweetheart. No. Once the seats are going to be announced, then only you can active your website. Okay. You can't upload your documents beforehand. It's not like that, because then you are not going to be allowed. Okay. Yeah. Okay. So now I'll be talking about how we are going to pass this exam successfully. Okay. Apart from our general tips, staying focused and staying motivated, and of course, studying thoroughly and not taking this exam for granted as well. And not undermining the same membership day exam as well, like I did. All right. So tips to prepare for this exam. First and foremost, first you have to ask yourself. First, you have to know what exactly the syllabus is, and you have to divide your time properly for revision and the SPS. Question about training: do you require recent? No. Actually, it's a good idea that it is in the recent the 4 to 5 years. Okay, but it doesn't matter. Even if you have done it before, okay, if you are FCPS trainee or MCPS trainee from Pakistan, okay, so at least you can send your documents. So they will give you the kind of feedback. If it is accepted, then well and well good. If it is not, then they will give you feedback. Okay. It's not that recent, but overall it has to be the combined training in obstetrics and gynecology. All right. So first of all, you need to know what your syllabus is. Okay. Like, the baby step. First of all, you have to know. Then you have to divide your time properly for revision and single best answers as well. All the time you have to be looking at this picture. Why am I doing this? If you know the answer, you are successful. Yes. You have to upload your all documents, sweetheart. MBBS degree, make sure that it is scanned in your laptop. FCPS degree or MRCOG part 1, the certificate, it is scanned and it has to be PDF scanned. Okay. Professional. Not through your mobile, not through, because, because of the font and because of the changes. Okay. Once they are going to be on website, the images cannot be, the exactly. So it has to be professional, the PDF. Okay. Your part 1, your experience certificate, your FCPS or exemption certificate, and that's it. Because everything is going to be on website. You just have to enter your, the qualification, your, the credentials and everything. All right. And yes, one more thing. Make sure your name matches, because for every international exam, your passport is your identity. All right. And because with the passport, you have to make your, the account. So make sure that the name matches on your passport and on your all documents as well. Because afterwards, after doing MRCPI, once you are going to start working for your career or, applying for the job, then again, the same thing will, happen again. All right. Yeah. So make sure that you are ready beforehand, before the seat announces. So, the things are going to be easy for you. All right. So know your syllabus first. So first of all, we are going to talk about the syllabus. So roughly we have got RCPI guidelines. Those are freely available on www.rcpi.ie. That you have to do some of the green top guidelines. Roughly they are 10 to 15. 40 I have written. Why? Because they are changing their guidelines. Okay. So till date in 2023, we have got almost, I think I have counted the other day and I have written as well, 16 are the 2023 guidelines, new guidelines. Can you imagine that they are changing? They are changing and we don't know what will happen in next 2 months because exam is going to be in March. So we have to be very vigilant with all these new guidelines as well. All right. So the roughly archived guidelines which are there. So we are going to be choosing and we are going to be teaching you what are important. Okay. Important exam, the aspects as well. Some of the green top guidelines are important. Like I said earlier, because now we are going to be competing with MRCOG as well. So yes, anything which is not available in RCPI website, we have to cover it from green top guideline. Okay. So roughly we have to do 10 to 15 guidelines from green top guidelines as well. Okay. So it's not going to be like, exactly you have to do them. But the thing is, if you are well versed with the topic, I'm going to be telling you what MRCPI wants from us as an exam candidate. Selected TOG articles. And TOG articles are going to be very selected because otherwise TOG articles are an ocean. You can't just go and pick all TOG articles and we just have to do selected TOG articles, clinical ones. Sorry. Selected BASH and FSRH guidelines, roughly 5 to 15s. For me as an exam candidate, roughly 5 because I don't like these guidelines. So rather I would master on all these. So everybody has a, the plus point and, the negative point as well. Some of the nice guidelines we have to do, like incontinence, like we have to do some of the labor part, but infertility guideline, because infertility is new in the RCPI. So we will be covering RCPI rather than NICE. Earlier than 2023, we used to cover NICE guideline. Okay. NICE incontinence we have to cover, NICE, cesarean section we have to cover, NICE, some of the other, the guidelines we have to cover. So roughly you can say 5 or 10 or maybe 12, not more than that. So by just having a, the look at this, the slide, you can imagine that this is not a very extensive syllabus. This is not a very extensive and exhausting syllabus. But yes, the syllabus is there, isn't it? So you have to cover. So what you have to type, because yesterday I got a message from one of the candidates that I cannot, find out guidelines. So what you need to do is you have to type on Google www. Please write it down with you because somehow their website is not friendly like MRCOG. So you have to search. Okay. You have to type www.rcpi.ie. Then there is going to be a column, National Clinical Guidelines. Then there are going to be National Clinical Guidelines, NWIHP and IOG 2021 and present. Okay. You will click on this and, you will get a whole list. PDF, their summary, their, the kind of their flow charts and everything very beautifully. But of course, it is little bit, the tricky and little bit difficult to handle than MRCOG and the NICE website. Okay. Then, you have to cover, the all these, the NWIHP, National Clinical Guidelines. Okay. Whatever is given. So almost 16 guidelines are there, which have been revised in 2023, roughly. Varicella pregnancy, management of rheumatic disease in, okay. Now just scan with me. And you will, agree with me that this exam is all about clinical, the scenarios. Rheumatic disease in preconception, antenatal and postnatal period, induction of labor, fertility, assessment and management of stress urinary incontinence, MASH complication, pelvic organ prolapse, management of placenta accreta spectrum, management of primary PPH, management of postmenopausal bleeding, complication of early termination of pregnancy, recurrent miscarriage, the fetal anatomy ultrasound, stillbirth, vaginal birth after cesarean section, prevention of early onset, group B streptococcal disease in term infants. Isn't it clinical? More towards clinical. Almost all clinical, the scenarios, they can come across through this. So you have to cover all these guidelines, okay? Then you have to cover some of the archived guidelines, but still archived guidelines are on website, so you can download them. If not, we can help you with, okay? So ask in, the course group, so we will help you definitely. Then the hot topics, what, this Irish college wants from us, amenorrhea. Now, please have a look again at this, the list. Almost all these, the cases are very much clinical. Amenorrhea, endometriosis, polycystic ovarian syndrome, labor and its management, ovarian cyst. This college loves about ovarian cyst from childhood to menopause. You won't believe. From childhood to adolescent to pregnancy to, the, premenopause and postmenopause as well. Okay. It is very much important that you have a very good grip on ovarian cyst, ovarian torsion, hirsutism, hyperprolactinemia, Down syndrome screening, infertility, contraception, hormonal replacement therapy, menopause and related issues, osteoporosis. So almost all these topics are there. So from where you have to study, again, question arises. So we do have guidelines, right? MRCPI guidelines. We do have, the Green Top guideline. We have TOG article as well. So we need not to worry about that from where we are going to get all these, the topics. Almost all these sources are freely available on Google. But make sure that you are just studying from MRCPI, from RCOG, or from TOG article. Okay? Not from any other, I must say, it's not going to make any difference. But still, if we are going for any exam, we have to be very much, the using the recommended sources. Clear so far, everyone?
Yes, ma'am.
All right, very good.
Hello, Dr. Zaib.
So, I can't hear you. Hello, yes.
I am Hanan, Dr. Zaib.
Hi, Hanan, how are you?
Hi, how are you, Dr. Zaib?
I'm good, Alhamdulillah.
I have a question regarding the consent and the medical errors for the MRCPI. They are the same guideline for the MRCOG?
Consent guidelines and MRCPI. And what? Errors?
Medical errors.
So far, we have been following MRCOG, okay, consent advices, but because I have told you that they are changing their website, okay? They are changing their website, okay? These 16 guidelines came in 2023 only. So I am expecting, I'm expecting more guidelines, more clinical advices, and clinical errors. Yes, I think more the UK and Ireland system is almost, the similar. Okay.
And for the abortion?
No, sweetheart. No. Complications of early termination of pregnancy. Okay, if you will go through this guideline, you will get, the couple of clinical grounds as well. Now I got your point. Okay. This is a new guideline.
Is the abortion is accepted, or the termination of pregnancy accepted to 23 weeks, or like the MRCOG, or no?
No. There is a slight difference. So I won't misguide you because I don't remember exactly, but there is a difference. Okay. That's why, they are making their own guidelines. Can you see that they have made, the GBS, they have made placenta accreta spectrum, primary PPH, although we have had very beautiful MRCOG guidelines, but things are very much changed. I'm hoping that they are going to bring more guidelines as well, because preterm labor was extremely different. When I was a student at MRCPI, I had a hard time to learn about all these weeks and days and all. Okay. So I will not, the misguide you because I don't remember exactly, but yes, I agree that, the weeks are changed. Okay. Weeks are changed.
Yes. Thank you.
Okay. So almost all these, the TOG articles are there. Okay. So what you need to do, first of all, you have to make a good schedule. right? Nafia, yes, almost all these things are available on your portal. MedExam team will guide you, okay? So they are going to give you access and everything. So for you as an exam candidate, first of all, now syllabus part is clear. Now what you need to do is you have to make a schedule, okay? Now you have to make a schedule that how you are going to go about your own, the schedule, study, the life along with your clinical, and if you are, the managing your house, kids as well. So of course, you have to take out time. Then what you need to do, you have to take out time for daily revision and study, at least 2 guidelines a day. 2 topics, let me tell you, okay? 2 topics a day at least. Do all relevant single best answer books, but beware with keys, because almost all, the books are MRCOG based, right? So we don't have any MRCPI book per se. All right? Please, please, please do, the very cautiously and listen to me very carefully, because almost all single best answer books are MRCOG based, okay? None of the book so far is MRCPI exclusively. So you have to beware with the keys, okay? What you need to do is you need, the quality questions, and quality questions are available in all these MRCOG books. But yes, key can be different because guidelines are different, all right? Then what you need to do, you have to solve all recalls properly and note down all important topics which are recurring in every exam. Again, what mistake all candidates do is they try to mug up, they try to engulf all these recall questions. What are recalls? Anyone, please tell me, what do you understand from recalls? Anyone? I really am expecting very interesting answers. What are recalls? Farah? Nafia?
Recalls are the questions that usually come from the previous years.
Questions from previous exam as recall. Exactly. Recalls by a candidate, recalled by you after coming from
so it can be, they can have some mistakes, they can have some wrong answers, they can have some
exactly. So now let me ask you another interesting question. You are coming from exam hall after a stressful day, okay, even if it was at your home, but of course exam stress is there. So do you feel yourself capable enough to recall 100 questions along with options?
Not exactly.
No, right? No. So what candidates do is
some questions we can remember, like the very common questions, easy questions, but the long questions, long answers, long, like they have the
and sweetheart, the thing is you can't you can't memorize your exam, because in exam this is us as a candidate, okay? This is not something we are observing. This is not something, this is what we are going through, isn't it? So this is, 100% impossible for any candidate to come out of exam hall in a stressful situation and recall 100 questions, the long scenario, and then, A, B, C, D, E. This is very, and what our memory does it. I'm sure everybody knows, the level of memories. We do have a long-term memory, short-term memory, and, the extremely, the short-term, right? So the short-term memory will fade with your what? The ongoing, the stress. Now we are left with short-term and long-term memory. So what will happen is that, exactly, what will happen is that you might rephrase the same recall again, and you will say, oh my God, what I hear, oh my God, it was all from recalls. Oh my God, it was all from recalls, and I can surely pass this exam. And this is the biggest mistake for any candidate whosoever goes for this exam. Okay, doesn't matter you are so well read, doesn't matter you have done so many courses, doesn't matter you are enrolled with, I don't know, ABCD, EFG, I don't know who. But it is not going to help you at all. What is going to help you is your own study, your own concept, your own way to solve the question, not relying on ready-made recalls and, the ready-made, my understanding about this exam. I am not examiner, okay? I am not going to set your paper, okay? So please make sure that you are not engulfing all these recall questions. This is the biggest mistake. And I really feel, the bad when I see candidates running all the time recall. Trust me, it doesn't help in exam. And it doesn't even repeat that much. What does repeat is topic. They cannot change ovarian torsion. They may bring, the same question, but they may, the change the stem, the ABCD options. They may change the key. They may not change the question because ovarian torsion is not going to go anywhere. If they want to ask about, the management of ovarian cyst in adolescent and childhood, they cannot change the topic. But yes, they may change the question. But in our mind, what is happening is, because I have read this question in the last recall 2022, 2021. So yeah, this is a repeat, the exam. So trust me, I have been observing almost all these postgraduate exams since long, because I have been a student and now I am teaching as well. So I have a very, you can say in-depth insight of almost all these exams. Okay. They are not stupid. They are observing all of us. Okay. They know what exactly they have to ask, and they know, what exactly candidates do. So please don't rely on all these recalls, and don't just think of that by just doing and repeating and memorizing and mugging up all these recalls is going to help me in the end. Just, the emphasize on topics. Okay. That, okay, this time ovarian torsion has been asked, last time ovarian torsion has been asked, and in the year 2020 has been asked, 2018. So it means I have to study ovarian torsion very well. Got my point, Farah? Am I making sense?
Yes,
right? So this is how a candidate should go about. Okay. So please make sure. I can see that you guys are so enthusiastic, and I can see a couple of the candidates whom I know personally as well. So this is going to be a very the kind of sincere and a humble suggestion to all of you. Okay. So please don't do this mistake. Then SPA books, we have got a couple of, the MRCOG books, like I have told you earlier. What you have to do MRCOG Part 2 Single Best Answers. You have to do Brian McGowan. You have to do Justin Cooney book, Andrew Sizer book. Succeeding, but be extremely careful with keys. Even for MRCOG, we don't recommend it at first place. Okay? So this should be in the end. But yeah, all these single best answers should be done, okay, again and again. 100 questions paper is not that, the difficult. Anyway, so recalls are very much important, but make sure that you are just doing them. You are not memorizing them again. All right. Then Pass MRCOG is a very helpful source if you want to do. Otherwise, if you are enrolled with us in our, the course with med exam, so we do have a couple of, the mocks, what we offer. So yes, we are going to be giving you that by the end of your preparation, by the end of your online sessions are done. So you can have a practice, but otherwise, if you really want to do any extra thing, so Pass MRCOG, I would recommend Pass MRCOG. Do go for that. Okay. Yet again, don't go for hard copies which are available here and there. Okay. Always look for recent pool. Always go for recent one. Okay. And the online source is always reliable, rather than PDF format, which has been extracted in 2018 when I was a student. Okay. So don't do that. All right. Then comes another important part. Nafia, inshallah. We will be so happy to guide you, to be part of your success, okay? To be part of your journey as well. So inshallah, it is going to be very good. Trust me, okay? Because we teach in a very dedicated study group, and we teach in a very, the comprehensive way. We don't, the kind of stuff candidates with a lot of material that you will be lost in just material and all. Rather, we try to build concepts. Rather, we try to help in, the going through the exam. Okay, exam is not about, the doing 300 plus talk article, 400 plus talk. We do have, there's so many things. But in life, what you need to do, you have to be choosy. Okay, you can't sail all boats, at one time, right? So you have to choose yourself. Yes, Nafia, I'm so proud of you. Thank you. Okay, so inshallah, you will pass all these exams. All you need to do is just follow our, the guidance and direction. We're not going to, of course, derail anyone, because we equally care about you, students, and we equally care that you are enrolled with us and you are our responsibility. So me as a, the mentor, of course, I do try to give my 100%. And couple of, the candidates know me. Earlier, I used to teach from 2016 to 2020. I have been part of Part 1 team in med exam. Okay. So I taught MRCPI Part 1 for exclusively 5 years. So I have so many candidates from my Part 1 as well. So really, it gives me pleasure to see, all of you guys from MRCOG, from MRCPI. Okay. But yet again, we do have, there's so many. Samra, Aisha will help you. Okay. Aisha will help you. Aisha, please contact Samra. Okay. Farah, okay. No. Don't follow WhatsApp. For course candidate, you have to follow this my Telegram group, okay? Where I am, the present. Where me and Dr. Asma, we both are there, okay? No EMQs, no EMQs. Hanan, this exam is all about single best answer. Just do single best answer. I have given you advice that you just have to do what? You just have to do the quality questions, okay? From where you can get these books? You can get these books, okay? From all these, the free groups available on Telegram, all right? Or you can, the Ask Me. I'm freely available. I'm easily approachable everywhere, okay? WhatsApp, Telegram, Facebook. Even you are almost welcome, more than welcome at my place as well in Karachi. I can give you. Okay, thank you, Samra. Thank you so much. All right. So what you have to do for almost all candidates, okay, what you need to do is you have to follow 1 to 2 dedicated study groups for preparation. Once you know your syllabus, once you know from where to extract, things are very easy. It's not going to be that difficult. Okay. So just be part of 1 or 2 dedicated study groups. That's more than enough to pass any exam. Trust me. Okay. So you can follow any, if you are, the part of dedicated R course group. So I will advise to follow just Telegram group. Okay. Don't follow WhatsApp because WhatsApp is an open group and it's open for almost all candidates all around the globe, which are not even part of our course. Okay. So join us, join me and Dr. Asma. We are, the guiding as in med exam expert, the team. Okay. For MRCPI. And even Dr. Uzma is with us in OSCE. Okay. So we will be together and we are going to be working towards this MRCPI. So join med exam expert groups on Facebook, Telegram, WhatsApp for dedicated preparation because it's not like that we are just offering paid courses. We are running, the free courses as well. So this is for us. Okay. We are starting our, the live classes for MRCPI 2 written March 2024. So you guys are more than welcome. If anybody needs any kind of assistance, okay, because we mentor, we also have some kind of edge. Okay. Dr. Azza, yes, she's also joining. Okay. She will be taking another, the exciting, the kind of thing. Okay. So I am not, the here to, the announce that, but she's there. Okay. So for the long course, okay, for the theory part, we are going to be, the starting from today. Okay. So this is going to be a very exciting journey with all of you. So anybody who is not yet enrolled can enroll. Okay. You can, the ask from, the our med exam team. Okay. Aisha is here. A couple of other, the dedicated team members are here. Okay. Or even you can ask me too as well. Okay. Anywhere, you find me, I'm very, the kind of approachable. You guys know me. My name is Dr. Zaib Qureshi, and the same name is on Facebook, on Telegram, and WhatsApp. All right. So any assistance, I'm there. All right. So join us, and I'm sure, and I hope it is going to be an exciting journey. Okay. So we do have a closed group activity, specially designed for rapid and crisp revision as well. Okay. So we will have a very close group. We are going to be studying, and of course, after finishing our syllabus, we will have, the plenty of revision of our guidelines in terms of questions as well as recalls as well. Okay. So this course will give you, the opportunity to understand the syllabus properly, to have a rapid and crisp revision in the end as well. So, and plus after finishing this course, we're not going to leave you. We are going to be with you till your exam date. All right. So anyone who is interested can join us, and we are going to be happy to have you with us. All right. So now, let's everything is clear so far. Any question? Yeah. Abda, Arjuman, Asya. Gitanjali, Ghada, May, Samsung, iPhone.
Yes, ma'am.
No, ma'am. Thank you so much.
Okay, okay. Can you start single best answer? Okay. Have you read your syllabus yet? Or you just want to do single best answer? Sweetheart, don't rush. Okay. And why rush? Why rush? Huh? Are you leaving this group anytime soon? Nafia? No, right? Please don't rush. First of all, keep your concept. Okay. So if you think that you are well read and you have studied a lot, then only jump into the single best answer. Okay. Single best answers are not something that you can't do. But of course, we will have practice. We will have plenty of practice. You guys will be tired. And then you are going to say that, please don't share. We are so tired. Okay. Okay. So Mavish, have you read your, the syllabus, or you just want to do question? Have you read?
Dr. Zaib? Yeah, I have a question. Like in our Telegram group, we are given 1 or 2 like guidelines. Sometimes really I cannot complete the guidelines. Like they are sometimes very lengthy, and I really cannot do like the 2 guidelines. And then at the end of the day, when they are discussing, like somebody is Dr. Asma, and they are discussing, so I cannot reproduce the way I feel that some other students are doing. So that's why if this regarding the same guideline you have shared, if you can give us small like 5 or 6 like SBAs, what do you think, it is more good for us, or just we will have to read the guideline and just to revise the guideline?
Idea. It's a good idea that if you do it yourself, because you are a student, you are a newbie in this. Okay. Otherwise, summaries are available on website. Okay. MedExam portal is there to help you. But we as a mentor, we always recommend and encourage all of you to study guidelines. Okay. Because it's for you.
Fine.
It's for you. Okay. Because sometimes what happens is that if I have made summary, because maybe that summary was good according to my understanding, according to my perspective, but maybe it was lacking a point which was very good for you. You got my point. That's why, we should not rely on anything. But yes, summaries are helpful. It is there. Okay. And, the things are going to be there. All right. And it's a good idea that you study. And sometimes if you can't finish your, the one topic or something, okay, you can do it next day. You can do it next day, but don't delay. All right. 1 day, 2 day lag is okay. Even 3 day lag is okay, because we all hail a, the very busy life. All right. We have to take care of our hospital, our kids and everything. All right. So, the things are going to be very easy. So don't worry about it. And don't just, stick to this thing that I just have to finish, the everything today. Okay. So make sure that you are molding your schedule as well, but make sure that you are not leaving so much extra behind. Then in the end, you are going to be frustrated, and then you are going to be demotivated. All right. So at all times, you have to keep your spirits high as well. But do try to. What I used to do was, and what I did till, my last postgrad, the OSCE, because I'm a morning person. So I used to wake up in the morning, 3 o'clock or 4 o'clock. I sleep early. I wake up early, even if I'm not having exam or something. This is my routine from childhood. Okay. So I used to wake up early, 2 to 3 dedicated hours in the morning before going to hospital. I used to study. Okay. So study in that time. That is a very good time. Okay. Pray, whatever, meditate, exercise, whatever you want to do, then study for 3 to 4 hours dedicatedly. Get ready, go to hospital, work, come back, take a nap. Okay. And then, you can give. So what I used to do was, I used to study in the morning, and in the evening, I used to do, the questions. Because that is a pretty busy time. Okay. I am at home, I'm working, I'm managing things here and there, right? So questions can be done in that hour, which I think. So it all depends on what life are you hailing, what is your, the schedule and all. But for me, as an early riser, I think the education has been so easy for me that I never made any kind of, the extra fuss over my, the degrees or, the anything, because that was my usual routine. Okay. So you guys can also do that, but make sure that you are studying theory in the morning when you have to give your, the concentration towards that topic. And then in the later half of the day, even before going to bed, 1 hour is okay. If you do your 20, 25, 30 questions daily, I think that is more than enough. What exactly do you need out of your life? Nobody can study 24/7. Come on, don't become a robot, okay? And don't get indulged in books all the time. Give yourself time, all right? Give yourself time, go for a walk, the family time, movies, TV, music, whatever is, the good for you. Do that, because our neurons needs energy as well. Our neurons needs to get, the free time as well. All right. So I think dedicated 3 to 4 hours are enough in a day initially, and close to exam, you can increase it, because close to exam, this exam needs a lot of focus. Okay. So now we will do a couple of single best answer practice. So all of you guys are, the invited, and don't feel bad if your answer is wrong or something, because this is just going to give you an idea about single best answers, how you are going to go, because this exam is entirely different from MRCOG. Okay. If people who are switching from MRCOG to MRCPI, they might find it little bit easy in terms of, because extended match questions are not there. Okay. Only single best answers are there. All right. So this is my question to all of you. Anyone Farah, can you become a volunteer and read this for me, please?
Yes, sure, ma'am. Question 1 is, in first twin deliver 20 minutes, past second twin above pelvic rim, membrane intact, no uterine contractions. Number 1, await for uterine contraction. Number 2, ARM. Number 3, oxytocin. And number 4, LSCS.
Okay, so what's your answer?
Number 4, LSCS.
So if first twin has delivered, 20 minutes has passed, second twin is above pelvic rim, membranes are intact, no uterine contraction. So what's your answer is, sweetheart? LSCS? Why would you do LSCS? Farah, what do you think is the time between two twins delivery? 30 minutes, right? 30 minutes. All right. So if one twin has delivered, the cervix is already fully dilated, isn't it?
Okay.
Okay. Cervix is already fully dilated. And the second twin is above pelvic rim, means above 0, minus station. Membranes are intact, but there are no uterine contractions. So what you will do? You will start syntocinon. What my point? You will start syntocinon, contractility will occur, and the baby might, they get, they engaged, and, the head will come down in the vagina. Even if not, even suppose if uterine contractions is not in the question, what you will do? You can
Sorry, ma'am. Sorry, ma'am. How oxytocin with intact membrane?
Yes, intact, because
Breech
it is
extraction.
Twin. It is twin. It is twin. It is twin. It can be, the diamniotic dichorionic twin. Okay. So cervix is already dilated, right? First twin has been delivered.
I mean, give here it's written intact membrane.
Yes, yes. Because cervix is already dilated. You don't need dilatation.
So no need to make ARM? ARM, I mean?
No. This is above pelvic rim, very high. There can be chances of cord prolapse. There can be chances of, the hand prolapse or anything. Okay. In twins, you don't do that. Okay. So in twins, you have to be very careful. So first you will start the contractions. Okay. And if contraction option is not there, what you will do? Internal podalic version and breech extraction. What will happen in that? You will grasp the fetal feet. You will bring it down into the vagina, and you will deliver both feet with intact membranes. Okay. Or you may do ARM. You will keep your hand in the vagina, but make sure that first you locate the fetal feet. And this is pretty, the clinical. No. Intact membrane is not a dyspector. Okay. Please don't fall for this trap. It has nothing to do with intact membrane. This is twins, and twins delivery is fairly, the different than singleton pregnancy. Okay. Go back to your OPS books, major books. Okay. What is that? High risk books, or, the any labor ward protocol. Do open it and read it, because in MRCPI, you might need all these, the clinical aspects. All right. You can't do, how you will await for uterine contraction? You can't do ARM on high head. You can't directly go for LSCS. Even after the method of exclusion, you are left with oxytocin. Farah, making sense?
Yes.
Okay, great. Never choose LSES in exam at first place. Always remember, guys. Okay? Always remember. Until unless, the LSES is an only indication. Okay? All right. Next, Farah, please.
Question number 2. Whitish pruritus itching, thinning of labia minora, post-menopausal, no ulceration. Lichen sclerosis, vulvar dermatitis, VIN.
Answer will be 1.
Okay.
Lichen sclerosis.
Lichen sclerosis.
Let's rule out. Samina said A, Zaida said 1, VIN. How do you differentiate VIN from lichen sclerosis? Do you think VIN is a clinical diagnosis or histological diagnosis? What is VIN? VIN stands for?
Vulvar intraepithelial neoplasia.
Intraepithelial. So can you see intraepithelial outside? Huh? Okay, just answer me. Just answer.
Answer will be 1, na? Lichen sclerosis.
Lichen sclerosis. Let's see what is the answer.
No, vulvar dermatitis.
Dermatitis. How, sweetheart? How it is dermatitis? In dermatitis, do you get thinning? Thinning of the skin.
There is no ulceration like in lichen sclerosis.
In sclerosis, do you get ulceration, sweetheart?
White patchy ulcerations like in lichen sclerosis.
Because it is a recall, okay? They have done labia minora, but ideally it has to be labia majora, okay? See, this is what, I was discussing about.
But whitish pruritus and postmenopausal.
Yes, postmenopausal,
more lichen
whitish,
sclerosis.
more likely towards, the
Lichen
lichen sclerosis, right? So let me show you this chart that how we are going to differentiate amongst so many things, okay? Now see the buzzword. In lichen sclerosis, you see porcelain white papules and plaques, ecchymosis, erosions, loss of epidermis, fissures. Late signs can be loss of anatomy, fusion, adhesion, lichenification. This disease can have a figure of 8 appearance. Okay, so what are going to be your buzzwords in your answer? Postmenopausal, white plaques, papules, itchy, and thinning of your labia, right? It is going to be a tissue paper kind of, the things. All right. This is another buzzword. We are going to be discussing so many questions, and I will teach these vulval anatomy and all, okay, in your course. So don't worry about it, because I don't claim, but somehow, I have a good grip on this. So I will teach all the buzzwords, how to differentiate, how to solve questions and everything. But almost PPP is going to be there, lichen sclerosis, porcelain, papules, plaques, purpura, okay, and figure of 8. And porcelain white, thinny skin, itchy skin. Okay, so clinically, if confident, or sometimes you have to do the bulbal biopsy, or you may consider biopsy if there are indurated or suspicious area. Primary treatment is going to be ultra potent topical steroids and emollients. Okay, clobetasol propionate 0.05%. Okay, this is going to be a 30-gram tube, and this has to be used for 3 months. Who is going to manage? Gynecologist, dermatologist, or GP referral for services. And, in resistant cases, you are going to send for the vulval biopsy to exclude what? Vulval intraepithelial neoplasia. The second condition, what we see clinically is lichen planus. Okay, so it has got, the Wickham stria, the lacy white lines surrounding the skin. Okay, it has got, the purple, the purplish plaque. Okay, there is going to be, the pink kind of, the plaques. Okay, it will involve mucosa, lichen planus. All right, so clinically, it is going to be important. All right. And it is going to be, again, treatment is almost for all skin lesions. Treatment is super potent topical steroid. Okay. Yes, planus will involve mucosa. Then eczema and dermatitis. For somebody who has said dermatitis, sweetheart, now this is for you, this answer. Okay. Contact dermatitis is of irritant form and allergic form. Irritant form is going to be poorly defined erythema present where the irritant has been applied. Allergic form is going to be erythema extends outside the area. In both, there may be excoriation of the skin caused by scratching. Clinical, the examination is mandatory. And sometimes you have to go for patch testing if allergic contact dermatitis is suspected. All right. And treatment is going to be accordingly. Okay. So most of the time, this is going to be lichen sclerosis. All right. Whitish, itching, thinning of labia majora, postmenopausal, no ulceration. So this is most likely lichen sclerosis. But if the diagnosis is uncertain, you will go for biopsy. And you may look for vulval intraepithelial neoplasia later on. Okay, but remember, you can't diagnose VIN by clinically. Okay, this is histopathological diagnosis. All right, next question. Anyone, please? Yes, Farah?
Yes, ma'am. Question 3, renal transplant taking immunosuppressant teratogenic. Number 1, mycophenolate mofel, tacrolimus, prednisolone.
The question is, they are asking that in renal transplant, the case, which drug is teratogenic? Farah, what is your answer?
Mycophenolate.
Yes, mycophenolate mofetil. Okay. Tacrolimus is safe to be given. Prednisolone is safe to be given. Okay, very good. Very good, Faiza. Very good, Samina, Abda. Answer is A. Okay, I agree. Answer is A. Yes, teratogenic is mycophenolate phenolate. Okay, so these are the drugs for, the renal transplant. Okay, sulfasalazine. We have got, the aminoglycoside, sulfasalazine, mesalazine, metronidazole, steroids, thioprenine, calcineurin inhibitor, all these. So it is important that, we can give this, but we can't give mycophenolate. Okay, next question. Pregnancy, 12 weeks with HIV. She is on antiretroviral therapy. Viral load is undetectable. Now, this is a very ambiguous question, isn't it? Because this is from your favorite recall questions. So nobody can get the idea what exactly the question is unless you see the options. Option number 1 is if hepatitis C positive, coincidentally, it will require cesarean section. Or option number 2 is fetal transmission will be 1 to 2%. If cesarean section, then will require zidovudine. Now, the viral guess is going to be there. Two, fetal transmission, 1 to 2%. Argument 2, fetal transmission. What about A? What about A? If any HIV patient is having, the coincidental HCV, don't we go for cesarean section, isn't it? Then fetal transmission will be 1 to 2%. I think it is less than 1%. Though I'm not very good in all these infections kind of thing, but some, the few things are there. If cesarean section will require zidovudine. Okay. So ideally, it has to be, the A. RCPI guideline says that if any HIV patient has HCV coincidentally, it requires cesarean section. Okay. So far, what I remember is fetal transmission is less than, the overall risk varies from 20 to 40% compared with less than 0.1% with the, the management recommendation. Without treatment, this much, and less than 0.1% is with treatment. Okay. Yeah. So make sure that you are answering your questions according to the Irish guidelines. Okay. Irish infection guidelines are huge. Okay. So because they really want to cover almost all infections, including, you won't believe, listeriosis as well. Okay. So very important. So this is from Irish guideline that HIV can be transmitted from an HIV infected woman to her infant during pregnancy, labor, and delivery, or through breastfeeding. 25 to 30% of perinatal HIV may occur in utero, and up to 70 to 75% peripartum. It means during labor, transmission is more. Okay. Now, fifth question. Anyone, please, can study? Or Farah or anyone? Asia, are you there? Can you read it for me? Nafia?
Can I read?
Yes, please. Anyone?
Yeah, I'm Zainab. Pregnant woman with previous personal history of venous thromboembolism. She has family history of thrombophilia. Her BMI is 35, 80 kg. She needs low molecular weight heparin. What is the dose? Note, the question is revised from the previous question, additional data inserted, previous personal history of VTE. Pregnant patient with family history of VTE. Her BMI is 35. She needs low molecular weight heparin. What is the dose? Any additional points are added there. 5,000 tinzaparin OD once daily, 4,500 tinazepam once daily, 175 microgram per kg per day tinazepam. Number 4 option is no need for low molecular weight heparin. Number 5 option is low molecular weight heparin postpartum.
Why C, Abda? Why C, Abda? 80 kilogram is too much that you want to give her from the body weight?
And the answer will be B, 4,500 tinazepam once daily.
Yes, answer is going to be
2.
Okay. It is 175. It's a distractor. Ideally, it is 75 only, Abda.
Yes.
Maybe you missed 1. Okay, 175 is too much, sweetheart. Okay, 175 is too much. So you can't give through 175. You don't want to kill the patient, right? So this is 80 kilogram. So less than 50, 50 to 90, 90 to 131, 131 to 170, and more than 170. Okay, so for enoxaparin, you have to add 20 for every addition of 40 kg weight. You have to add 20 units of enoxaparin. Okay, from dalteparin, you have to add 2,500, 2,500, 2,500. See, 2,500, 5,000, 7,500, and 10,000. Very easy. But for tinzaparin, for less than 50 kilogram, it is 3,500 units. 3,500 will come here. Okay, 1 is going to be 3, 2 is going to be 4, 4,500 and 9,000. Okay, now our patient is having 80 kilogram weight, so it will fall in this category. So remember, in RCPI curriculum, they want to talk about tinzaparin and dalteparin. They don't talk much about enoxaparin. Okay, in questions, enoxaparin is RCOG favorite. Okay, and this is RCPI favorite. So feel the difference, my dear colleagues. Okay, feel the difference and then study. Is it clear so far? It's going to be a very easy, the kind of formula to memorize. Okay, otherwise this table looks so horrific. Okay.
Yes.
Okay. Yes, Nafia. Next. Oh, yes, Zainab. Next question.
Yes. Patient with molar pregnancy, surgical evacuation done, and beta HCG, 20,000 international units on 3 consecutive samples, 2 months after evacuation. She was noted to have lung metastasis. Other sites, no evidence of metastasis. Management, hysterectomy with single-agent chemotherapy, single-agent chemotherapy, multi-agent chemotherapy, subject for re-evacuation, repeat beta HCG again before initiation of the treatment.
Okay.
After 2 months, can we give?
So let's find out. Okay, patient is molar pregnancy.
Yes.
Post-surgical evacuation, her beta HCG is 20,000 on 3 consecutive samples. In 3 consecutive samples, 2 months after evacuation. It means it is static. It is static, plateau. Okay?
Plateau.
It was noted to have lung metastasis. How much score is for lung? 0. Doesn't matter. Lung score is 0. Other sides, no evidence of metastasis. So what you will do for this woman?
Answer can be 4. 4.
Hysterectomy, let's exclude and then we will go for yes. Hysterectomy plus single agent chemotherapy. Of course, hysterectomy is not an option, right?
No.
Single agent chemotherapy, what is the score? See, because this is also recall. Have you guys noticed? How do you give score? What do you need to know? What do you need to know? You need to know age.
No.
You need
Yes,
to
ma'am.
know the current
Size of metastasis
exactly,
and
the size of meta. So how do you Faiza, lol.
it's
That's why,
incomplete.
I always ask you guys, please read question. This is what I want to emphasize. Okay? Because all the time we can't miss and overlook important, the information, isn't it? So make sure that you are reading question carefully. All right. Coming to this question, and if we really want to, solve this question, how we are going to solve? We need to know the age, antecedent pregnancy, then interval months from end of the index pregnancy to the treatment, pre-treatment HCG, large tumor size, site of metastasis, number of metastasis, previously failed chemotherapy. Okay. So we would like to have a score and we would like to have, the kind of thing. So how much score is there? Only 20,000 we only know, right? Lung metastasis is 0. This is 0 column and lung. Remember, guys, this is going to be a golden tip for all of you. Okay. Lung metastasis. Yes, golden tip. Okay. Because this is you students who always do the mistake. Lung metastasis, 2 score, madam. 1 score, madam. So it is a 0 score. Doesn't matter. Lung is fully gone. Lung is, the 0. Lung has 4 centimeter nodule. Lung has 5 centimeter metastasis. It is going to be scored as 0. Okay. Is it making a golden, the tip now or no?
Yes, ma'am.
Okay, good. So don't make this mistake. Okay, again. Innocent lung. Yeah, bichara. Right? So this is going to be score of 6 or below is going to be single agent, although this question is pretty incomplete. So in exam, all you need to do is you have to, memorize this FIGO scoring system. Yeah, you have to memorize this FIGO scoring system. However, in this question, keeping in view of this 20,000 static and, you have to go for it because patient is not bleeding at the moment. Okay. Patient is not torrentially bleeding at the moment. So you can't go for a re-evacuation directly. You can go for, the methotrexate. Okay. If it was according to the guideline, if patient is having static, the beta HCG and patient is bleeding as well. Otherwise, re-evacuation has, the very less role according to Green Top guideline. So make sure that you are not choosing any drastic treatment so rapidly. Okay. So keep your threshold and keep your, aggressive mode very low in exams. Okay. Don't go for, the answers which are very harsh or which are very aggressive. Okay. Next question. Anyone, please.
Can I?
Yes, please.
Menopause with bilateral ovarian cyst measuring 6 centimeter. The left is bilobe. Otherwise, no other feature. CA125 is 30. Management. Aspiration biopsy, total abdominal hysterectomy plus BSO ovarian cystectomy. Observe and repeat CA125 after 6 months.
Okay.
Menopausal.
Now, this is menopause. Okay. So how do you score menopause? By RMI index, right? RMI index. Okay. Now tell me, what are the criteria for RMI index? We are going to score, right? We are going to score. We are going to score on the basis of menopause. And menopause has how much score? 3, right?
3.
Yes.
3. Okay.
And
And then we will
ultrasound
go
score.
for CA125. Well, how much is CA125? 30. And then we do have ultrasound features. In ultrasound, we do look at what? Bilateral. Okay. We look at, the simple or, the complex. Then we look at the
Fine.
flow, okay? Flow. So this is going to, how much is going to be this? If 1, score 1, more than 2 or 2 is going to be score 3. All right. So here 2 cyst bilateral and 1 having bilobed. So how much is going to be score? 3.
323.
How much is the score now? Please calculate. 270, isn't it?
Yes.
Sorry. So what is going to be the option? And what is the chance of malignancy? If it is more than 200,
more than 250 is significant.
75% chance of malignancy, more than 250. Okay. Less than 250 is 75% or 25% chance. So here it is going to be 75% chance. So what you will do in this scenario? Aspiration biopsy, no role.
No.
Ovarian cystectomy, no role. Observe and repeat. So we will go for TH. Okay. So even in exam, if you don't remember RMI index and if you fail to calculate, don't worry. Don't worry. Use exclusion criteria. Okay. Exclusion criteria is solely based on your background knowledge, your common sense. Okay. Always remember, aspiration biopsy or aspiration for ovarian cyst is never recommended. All right. In the postmenopausal age group. Ovarian cystectomy alone has no role. You are not just going to remove the cyst. You have to remove the ovary. You can't observe CA125 after 6 months. So you are left with THBSO. Making sense, right? All right. So this is your RCPI, the guidelines in which, you are going to be following ovarian cancer GP referral for symptomatic women. So this is again same RMI index. Okay. Clinically, patient will present as abdominal distension, early satiety, loss of weight, loss of appetite, pelvic or abdominal pain, increased urinary urgency frequency, new onset of IBS symptom. In postmenopausal women are always dangerous. Or clinically, if you see SITs, DVT, change in the bowel habit, weight loss, fatigue, you will go for CA125, you will go for pelvic scan, you are going to be offering patient will be referred to gyne-oncology team. Okay. If patient has any, the kind of sign and symptoms that you need to go for it. If ultrasound is suspicious for cancer, patient will directly go, with the copy. If CA125 is more than 200, you will refer. If CA125 is more than 35 and continues to rise on retesting, but pelvic ultrasound is still normal, who can refer to gyne-oncology? You, the GP, when the patient meets the criteria in this guidance, okay? And when is a referral to gyne-oncology is not appropriate. If patient has benign gynecological condition, referral is inappropriate because at the same time, you can't, the kind of barge everywhere. You can't, put stress on your fellow colleagues as well. At all times, you have to take care of yourself. At all times, you have to take care of your colleagues as well. All right. So this is a whole algorithm you will be reading in the postmenopausal guideline. So I'm not going to go into the depth. Okay, next question. Anyone? Volunteer, please. Anyone can read it. So it will be easy for all of us to understand.
A 25-year-old woman undergoes an emergency cesarean section at full dilatation following a failed instrumental delivery. Regarding CS at full dilatation, which of the following is correct? CS at full dilatation is associated with almost double the risk of intraoperative trauma. Frequency of constipation is higher at 1 year with CS at full dilatation. Increased maternal BMI increases the risk of CS at full dilatation. Risk of wound infection is higher with a CS at full dilatation than operative delivery. Women undergoing an operative vaginal delivery are less likely to report difficulty in conceiving and more likely to have a further pregnancy than those who undergo a CS.
Okay, first let me ask you guys, is it a clinical relevant scenario or no? It is, right?
Yes.
We do see, yes, very much, right? Every other
Hmm.
day we do cesarean section at full dilatation. Okay. The
Yes.
reason can be anything, right? Obstructed labor, prolonged labor, failed instrument, or it's a very the likely case. So what do you think is the answer, sweetheart?
Maybe E.
Your E. Okay. Now let's see. Women undergoing an operative vaginal delivery are less likely to report difficulty in conceiving and more likely to have further pregnancy than. Does it have any chance, sweetheart, on conception?
No, ma'am.
Answer can be A.
We will narrow down. We will narrow down because single best answer needs, the technique. It's not as simple and as easy, right? So we will just narrow down our option. So let's conclude. Let's just look at it. Cesarean section at full dilatation is associated with almost double the risk of intraoperative trauma. It can be or it cannot be. We will narrow down. Okay, later on. Yeah. So frequency of constipation. Constipation has nothing to do. Increased maternal BMI increases the risk of cesarean section at full dilatation. It can be or it cannot be.
Can be.
Then we have to choose the best. We will narrow down our all options and then we will choose our best answer, right? So bear with me. So risk of wound infection is higher with the cesarean section at full dilatation than operative delivery. It can be or it cannot be, right?
Can be.
And fertility has no problem. It is not going to enhance any fertility chance or something, right? It can be associated with post-traumatic stress disorder. Okay, it can be associated with tocophobia later on, because cesarean section at full dilatation is a very, the bad thing. Because we have to know the counsel, right? We have to counsel patient who has already taken a long, huge trial for labor, and now she is going for cesarean section. Nobody knows about it. Narrow down, right? Okay, it is A. All right. It has double the risk of intraoperative trauma because cesarean section at full dilatation. We have done multiple PV exams. Cervix is already, the inflamed, edematous and everything, right? And, the things are, the very bad. Okay. Sometimes I have done one cesarean section after full dilatation where I had to repair all the cervical tears as well, post cesarean, because patient was bleeding. Cesarean section was done and everything was done, but still patient was bleeding from vagina. Then I had to explore intravaginally. Then I found out that there were, the couple of, the tears because of the multiple PVs, cervix was edematous, and, the patient was bleeding. So somehow it is very tricky at that time. So the risk of intraoperative trauma is very high. Okay, forgive me for the key. It is A. Okay, it is A. Clear, everyone. Agree,
Yes.
Hanan?
Yes, agree.
Okay, sweetheart. Okay, now again, please read. Yes.
A 24-year-old woman attends your clinic for emergency contraception after 2 episodes of unprotected sexual intercourse over the last 24 hours. She is currently on treatment for tuberculosis, which is the most appropriate contraception to prescribe her. Copper IUD, Implanon, levonorgestrel, Mirena, allopurinol acetate. Copper IUD.
Copper IUD. Why?
These patients taking enzyme-inducing drugs. Yes. So Implanon is not
because in anti-tuberculous drug, we don't know which drugs is she on, because couple of drugs are inhibitors, couples are inducers, right? So we may narrow down our option again. So hormones, and she is here for after 2, the unprotected sex. So copper IUD, very good. Okay. Which is not affected by the liver enzyme inducing drug or even HIV post-exposure. The copper IUD is not available or acceptable. Then women can be asked to take 2 LNG tablets stat, 3 mg. Okay. Yes. So it is very much important that, we have to look for history. We have to look for any comorbidities. We have to look for, the anything. So very, very good answer, in fact. Okay. Because ATT, for me, when I was reading this question, and I never knew that, what type of ATT is she on. But assuming that most of the ATT are, the enzyme inducers, so we have to be sure of that we are not giving any enzyme, the hormones. Good. Okay. Another question.
A 24-year-old woman presenting with a history of menorrhagia is found to have a 4 centimeter simple left ovarian cyst. What is the most appropriate management? Obtain consent for laparoscopic left ovarian aspiration. Obtain consent for laparoscopic left ovarian cystectomy. Repeat the ultrasound in 4 weeks. Request serum CA 125. Routine follow-up is not required and the patient should be assured. E.
Very good.
E.
Why E? Because she is premenopausal, right?
Yes.
She is premenopausal. Yeah, simple cyst. Less than 5 centimeter, nothing is required, right? 5 to 7 centimeter, 6 monthly ultrasound. Okay. More than 7 centimeter, you have to require any intervention for premenopausal. Very easy, the question, isn't it? Yes. So even if somebody doesn't know any answer, again, apply the exclusion technique, right? Exclusion criteria. Like I've said earlier, in all ovarian cysts, aspiration has no role. So cut aspiration. Okay. 24 years for 4 centimeter. We can't do any directly laparoscopic cystectomy until unless we have more information. 4 weeks, it's not going to change any kind of scenario in 4 weeks. C125, we don't do in simple cyst, right? So we are left with this answer, isn't it? So make sure that you are using your all neurons and your background knowledge, your, the common sense when you are solving single best answer. Remember, what happens in single best answers? We do get to choose, see so many correct, the keys. That may be, some kind of misleading. But what is the catch? You have to choose the best. Okay? You have to choose the best answer out of whatever you think you have narrowed down. Okay? Clear, everyone? Any question? So it was just a kind of, the rehearsal that how we are going to study and we are going to solve our questions as well. Okay? For the candidates who are part of our course are going to be with us. For the candidates who are not, but still we are going to be with you guys, okay, in open groups. And you guys are free to tag me anywhere and in any question. I will try to help. But make sure that you know the basic essence of this exam, okay? Because this exam requires not so much of theoretical knowledge, but yes, some of the clinical knowledge as well. All right, clear, everyone? So with this positive note, we are going to wrap up our session for today. I hope everything is clear, how we are going to go for this exam, what documents are required, what is the scope, why we have to go for this exam, why it is mandatory again. So always remember that success doesn't come to you. You go to it. And how do you go to it? You work hard, you work smart, and then of course you aim for something. If you are going to aim for something, then only you can achieve. All right. So staying focused is very much important and mandatory for every exam there is. All right. And this Irish exam is going to be very, fruitful for your clinical practice. Trust me. Okay. So I will be with you as a mentor, okay, in MRCPI theory. And hopefully in MRCPI OSCE as well. And me and Dr. Asma, we both are going to be there. We both are going to be taking your online sessions. And plus, of course, we are going to be with you in your, the group as well. All right. So you guys are more than welcome to join us. And please give us opportunity to be part of your success story. Somewhere you can take my name as well. Oh my God, Dr. Zaib was my mentor. And so it's going to give me a very good feeling as well, isn't it? Very good, Farah. Very good, Farah. I'm observing you are working very hard. Okay. So please, enthusiasm and active participation is very necessary. Always remember, we as a mentor, we are done with this exam. So we are not going to go at your place. You have to work hard. You have to work smart. All right. For the single best answers, practice is very much necessary. Until and unless you will do your practice, things are not going to be easy. Okay. So please reach out to us if somebody has any question. Our doors are open. Okay. I'm, the easily approachable on WhatsApp, Telegram, and of course, the Facebook as well. Okay, do write to me if somebody has any concern. Otherwise, I will see you guys in our online session. All right. Take good care of yourself because weather is being changed and, they have plenty of fluid, water, everything. Weather is not good. Okay. So see you guys some other time, inshallah. Okay. Thank you so much. Good night.